You may have heard the term the curve thrown around when officials are discussing the spread of the coronavirus and how they want to flatten the curve. To help us better understand what the curve means and how you can help is the Valley Today's Abby Furchner. She joins us live this morning. Good morning, Abby.
Good morning, Lisa. The curve, or also known as the exponential curve, is used to show how an outbreak is affecting an area. And to give you a better idea, here's an example of two of the curves you might have seen being thrown around recently. And so if a curve is spiking like this means that it and then quickly drops off. This means that many were infected at one time. But a flattened curve or a bell curve like this one is what health officials are wanting to see here in America.
The idea behind flattening the curve is that you want to try to spread out that illness over a longer period of time so that you don't overwhelm the system with a whole bunch of sick people at one time. So the incidence or the number of people that get ill over a time might still remain the same, but you spread it out over a longer period of time. So instead of it being, let's say, within, a couple weeks, it might be within, a couple months.
Dr. Vetter said that the curve doesn't just show how the coronavirus has affected a country or an area, but it also shows how well we're doing with our public health. And that means proper hand washing, good hygiene, and of course, social distancing. Now, that's another term that we've been hearing a lot lately, and we'll kind of break that down here in just a few minutes to give you a better understanding of what that really does mean.
Yeah, it's a whole new vocabulary for sure. Thank you, Abby. Minnesota now.